My name's Jason Schuster. I'm a doctor of physical therapy. I own Intricate Art Spine and Body Solutions. It's a continuing education company teaching other doctors how to do a couple things. Before that, I was a fly fishing guide in Patagonia, Chile, and southwestern Alaska for a decade. This is really cool. So this is from a study on the bottom of this page, you guys. And this is an important thing to think about. For some reason, people think about scar tissue as dead tissue. Scar tissue is not dead tissue, though. Like, our living tissues are depositing the collagen to help our body heal itself, right? In normal circumstances. Collagen is the most abundant protein in the human body. So scar tissue is not dead tissue, although it's thought about as dead tissue. It plays a role in metabolism, you guys. It plays a role in the fact that as far as we understand, there's a lot less energy production going on inside scar tissue because it doesn't have as many mitochondria as regular like muscle tissue. So that dysregulates metabolism. It has its own metabolism. It's different than regular skeletal muscle tissue metabolism. So scar tissue is living tissue, and this is an article from Heart Cells. So one of the or from a heart study. So one of the things that we know that happens, you guys, is the inside of the heart will form these like ectopic foci, or they're like little pieces of scarred heart that you see happening in way more people than should be happening nowadays. Like random heart inflammation and heart damage, and the cause of that is obvious, but we won't get into that. And what happens is the actual scar tissue starts like becoming its own little pacemaker, and it starts sending the heart when they activate into abnormal rhythms. So that's one of the things they do when they put catheters up the femoral vein, and they go in and they ablaze like the inside of the heart. They zap the heart and they try to zap out those little abnormal scar tissue formations, although that's obviously making more scar tissue. Sometimes it works though, and it stops the abnormal the electrophysiologic function of the heart. So that is scar tissue specifically forming its own like electricity. And even though that may not be happening specifically the same way in the rest of the body, scar tissue is not dead tissue, guys. It's living tissue, and it needs to be addressed as such. I included this picture. This is from that heart scar tissue study, you guys. So this is one of the reasons why damage to your heart inflammation causes heart scar tissue, which is extremely detrimental for the rest of your life. Because if you just look at the red is like the red in this picture, you guys, is the scar tissue, and the arrows is electricity. So if you just think about, just really simplify this, electricity is going towards the scar tissue in one direction, and then because the scar tissue is a different density and different makeup of regular heart tissue, that sends the electricity, like it curves or it kinks the electrical current the way it's going, and it sends the electricity in a different pattern, which causes the heart muscle to start doing weird things. And that is like the different types of electrical dysfunction, disruptions that scar tissue within the heart causes. And that's basically exactly the same thing that scar tissue is doing in skeletal muscle tissue. It's just not causing as obvious and like severe of a problem where like heart attacks kill you. Muscle cramps are not going to kill you if they're not in your heart. But that's basically what's happening, is like this abnormal electrical gradient is the electrical smoothness or the electrical flow is getting disrupted by this denser abnormal scar tissue, which is pushing the electricity in this weird pattern. That's disrupting the normal pattern, and it's causing problems. Same exact stuff happens in other tissues. It's just not as like life-threateningly severe. Thanks for watching, you guys. If you like this clip, keep an eye on my channel. I'm going to keep putting clips from both of our online dry needling classes. This was a clip from our online dry needling 2 class, Dry Needling to Improve Men's and Women's Pelvic Health. Check it out on our website, intricateartseminars.com, or check out our school channel, school.com/CEU, SKOOL.com/CEU, to get a big discount on our dry needling bundle. It's a bundle of both of our online dry needling classes for a big discount.